This is Dr. Caudle Miller with Dr. Miller's Guide to Neurology. Today we're going to talk about Amaurosis Fugax. Amaurosis Fugax is a stroke warning where you get temporary loss of vision, generally to one eye, rarely to both eyes. It's like a black curtain pulling down over the eye or a shade pulling down over the eye. Other descriptions are just monocular blindness or dimming or fogging or blurring. It lasts for a few seconds or minutes, an hour. It's usually caused by either a thrombus or embolus, where you get temporary loss of blood flow in the retinal artery or ophthalmic artery. It's not a great design the good Lord made. There's one little central retinal artery that supplies this optic nerve, and you lose that nerve and you go blind. This can originate from a little plaque in your internal carotid artery. It can originate from the central retinal artery, the ophthalmic artery, the ciliary artery. Causes are often embolic. You can see it from the heart, mural thrombus. A big blood clot in the left atrium is too big to get out, but it throws little pieces. And that first artery in the brain is that ophthalmic artery. And this little plaque will shoot there. You can see it from a little plaque in the carotid artery. You can see it from vasospasm. You can see it from giant cell arteritis, lupus, polyarteritis nodosa, which is like a vasculitis, like an inflammation of the arteries. You can see it from polycythemia when your blood is too thick. You can see it from all the different coagulopathies, and we won't go into all of these, but they should be checked, like protein C, protein S, antiphospholipid antibodies, lupus anticoagulant. You can see it from thrombocytosis, just too many platelets. You can see it in malignant hypertension, subclavian steel, which is, where a syndrome we'll have to talk about later, where the subclavian artery robs blood, from the brain to supply the arm. And you can see it with surgery, like a carotid endarterectomy, where they clean out the carotid, and you can see it from cardiac casts and CABGs, and even from arteriograms. So there's an ocular origin. I'm going to leave this up to the eye doctor. A lot of different problems that are ophthalmologic. You also have a neurologic origin other than embolic, and things like optic neuritis. You see with MS. Compressive lesions like brain tumors. You can see it from papilledema, particularly from tumors, but also from benign intracranial hypertension, which is something we'll talk about later. You can see it in MS. You can see it with what we call a migraine equivalent. We talked about the constriction of the artery followed by vasodilatation. If it doesn't vasodilate more, you don't get the headache, so you can get a ophthalmic migraine. We call them migraine equivalents. Eye doctors call them ocular migraines or ophthalmic migraines. They can be psychogenic as well. I don't see that as much. It's not a common thing that's psychogenic. So that's Amaurosis Fugax. But let's talk a little bit about the workup. Start out at MRI, because many patients with Amaurosis Fugax will have a stroke, and you'll see it on the diffusion sequences of MRI. Diffusion weight imaging will show up a stroke within 9 minutes, and it lasts at least a couple of weeks, so it's very reliable. We always do an MRI if we can, CT if they can have an MRI because of a pacemaker or defibrillator or something like that. We check the carotid artery, make sure there's not blockage. Check CBC, to check their blood count, make sure their blood's not too thick or too thin. A chemistry profile, look at their blood sugar, liver and kidney function. This coagulopathy workup we mentioned earlier. We also do an echocardiogram. We prefer, rather than a transthoracic echo, a transesophageal echo, where they put the tube down the throat like when you have an endoscopy, and look at the heart from behind, because the bone, the sternum's not in the way. It's very reliable. And then we do a heart monitor. Most of the time 3 days, 7 to 30 days is the best. An event recorder, they're many times hard to get. So that's Amaurosis Fugax. So we're going to talk more about stroke issues later, and we're going to talk about all the clinical issues in neurology. So comment on my channel, like my channel, subscribe, and more later.